Kia ora, talofa lava. My name's Aniva. I'm the Clinical Director of Primary Care, and we've been working in a new way in terms of this Stop Gout program, trying to reduce the burden of disease in our communities. We know that Māori and Pacific families are affected far higher by gout, and this impacts greatly in their well-being. We know that we have tried to make a new way of working together more collaboratively in the community between general practice, pharmacy and with Arthritis New Zealand, really to raise awareness and change the way that we manage patients with gout. The way of working is new, and it's about us being able to have really good lines of communication with our community providers and also patients within the community as well too. And so really the collaborative approach is the key to this program.
Having the gout, for me, it's taken away a lot of my life. And what I mean by that is when you can't go and do things with your kids, you feel left out.
Very, very sore, very painful. I mean, you couldn't even put a blanket on your foot. It just was not nice at all.
Gout is a really painful form of arthritis. It tends to affect a number of joints, predominantly the big toes, but it can be your foot, your ankle, your wrist, and I've seen it in the elbows as well. Symptoms include a swollen, painful joint that's usually come on quite quickly. I'll see patients who've said, oh, the pain started last night. And it's that severe that they can barely walk, and often will lead to days off work or unable to participate in family outings.
Really important to be on, to see a doctor and get onto some treatment if you have 2 or more gout attacks a year. Often people think they don't need to until it's like happening all the time, but by then it's really hard to get on top of it.
We try to do in community is just build partnerships up, put gout on the radar, because it isn't even seen as an issue. People are like, really, gout? Isn't that just, you know, from eating too much? There's a lot of whakama or shame and guilt surrounding gout, so people don't even really like to talk about it.
I used to go to work, and when I used to get my attacks, they used to say, oh, you drink too much, you know. And especially my bosses, they used to sort of run me down because, you know, oh, you must be an alcoholic. You know, you drink every day, all that sort of thing, because you've got gout. And sometimes I used to think to myself, well, you know, you get pushed around, you know, too often, and you start thinking like that. So
I think what is important for people to know is that gout isn't an old man's disease, you know, and it's not a rite of passage. We're seeing younger and younger men affected by gout, and it is genetic. You know, it's predominantly genetic.
I've been on the program for just over a year now, and I haven't had an attack since I've started. But previous to that, I was getting gout maybe 3-4 times a year.
And we're getting extra funding as pharmacists to spend time going out and explaining a bit more about the medications and the condition. We're being funded to put the medication into blister packs, which look a little bit like this. They can aid adherence, which is sticking to the directions of how you're supposed to take the medicine, and following up the patients, making sure that they come back and get their packs when they're supposed to, that they get their blood tests when they need to, so we can see how well the medication's working, and then communicating back with their GP about their results and how their collection's going and what dose of allopurinol they've ended up on, so that we can decide what dose to keep them going on.
I've just found it really helpful, and the feedback I've had from patients is that they, in terms of accessing repeat medication, they don't have to wait for an appointment, and they can go in and they feel comfortable to go in at any time and ask questions. So I think it's a great way for the community to learn a bit more about gout and learn how to manage gout together.
I'm more out there with them, with the grandchildren, the wife. We usually babysit the weekends, out to the beach. Yeah, we're out to the beach park, take them up, walk. We walk because we stay in town. we walk to the park. I take them to the park and we out to the beach. Yeah. We've been shopping with the wife. Usually I don't even get out of the car.
The kind of conversations we have about gout make a big difference to how patients respond and what they actually do, their actual actions around gout. And obviously understanding it.
I think one of the most important messages to get across to the community or to the patients is that even if you follow a good diet and you don't drink fizzy drinks or alcohol, at the end of the day you can still get gout because it's a kidney problem, and that's why you need to have the allopurinol to keep those uric acid levels down.
It's about getting whānau, speaking to whānau, those mate-to-mate conversations, colleague to colleague or co-workers, those informal conversations where people can actually receive and hear the message.
A lot of us Māoris too, we don't like to ask for help because we think we can do it all on our own. But when you're down and out, a little simple phone call, it helps out. It helps a lot.
And it's really, really good. I don't think I can live without it now. I'll rather pick my balls up, so to speak, and go and see about it than stay home and suffer. It's not nice. No, my family suffered because I was suffering, and that's not good.
I recommend everybody get on the Stop Gout program. It's worked for me. Who knows, it could work for you.
Try it. What's the harm? You know, what's the harm? It's better than being hunched over and going, what's the use of life when I can't do nothing? Well, you know, try it. It's awesome.
Stop gout. It's good. It's really, really good. And you'll know the benefits once you start taking it. And you'll have one happy family.